Hi guys, this is Katie. I'm doing another project for UMGC. It's an informative briefing. Disclaimer, this is going to be on suicide, so if you aren't comfortable with that, you should click off this video. So when my eldest child was 12, I received a call that would forever change our family. Their mother was frantic, telling me that our child had overdosed on Tylenol. At the time, I didn't know the full story, but I had a feeling that this wasn't an accident. They had been asking hypothetical questions about death and suicide and watching concerning content online for quite a while. What I didn't realize is that our youth is facing an alarming mental health crisis. According to the Substance Abuse and Mental Health Services Administration, suicide is the second leading cause of death for children aged 10 to 14. Let that sink in. The second leading cause of death. And the World Health Organization identifies it as the third leading cause of death in people that are 15 to 29. These statistics are not just numbers. They represent children and teenagers, young adults, lives lost and unfulfilled. But there is hope, and there is something that we can do about it. Mental health is integral to our well-being. It shapes how we think and feel and respond to life's challenges. Mental health affects not only our emotions and thoughts, but also our relationships with others and our ability to make decisions. Everyone has mental health, and it requires care just as physical health does. Yet, when it comes to youth suicide, the warning signs often go unnoticed, leading to tragic consequences. Suicide is complex and influenced by many factors, such as social isolation, poor relationships with family and friends, substance use, trauma, abuse, or exposure to any of these things, and a lack of coping skills. In my own experience, warning signs were subtle at first. Hypothetical questions, carrying a box cutter for protection, and then asking later for a first aid kit in case they had gotten hurt in the woods. I didn't recognize the signs at the time, and by the time I understood the gravity of the situation, it was almost too late. So recognizing the signs is very important. The earlier you can recognize the warning signs of suicide, the sooner we can intervene. These signs may include talking about suicide or wanting to hurt oneself or others, significant emotional distress, changing in sleep patterns, sudden outburst of anger or emotion, an increase of irritability and agitation. All of these signs are red flags and shouldn't be ignored. Excuse me for just a second. But it's not just the children who are at risk. It's about the families and friends and entire communities that are impacted by the ripple effects of suicide. The question is, what can we do to address this urgent issue? One of the most important steps in suicide prevention is fostering connections, providing support. It is critical that youth have access to trusted individuals, whether they be family members, friends, teachers or coaches, or a mental health professional, anybody that can offer help and understanding. Even a single person who is available to listen can make all the difference. The federal government has recognized this crisis, and in July of 2020, they launched the National Suicide Prevention Hotline, now known as 988, in partnership with the Substance Abuse and Mental Health Services Administration. The simple 3-digit number offers a lifeline to those in crisis, and making it easier for somebody to reach help and support in the moment of an acute crisis. Furthermore, ending the stigma and encouraging health-seeking behaviors is important, because the stigma surrounding mental health issues and suicide can actually prevent those in need from seeking treatment or help. It is essential to normalize the conversation around mental health, to let individuals know that sometimes it's okay to not be okay. Educating ourselves and fostering open dialogues and supporting youth through education and counseling programs are critical steps in preventing suicide. As individuals, we all have a role to play in helping others feel understood and important. As I reflect on my own experience, and I realize it is important to be proactive in recognizing the signs and seeking help early. My child's crisis was one of many, but it is a reminder that youth suicide is a tragedy that can be prevented if we are willing to listen, learn, and connect with others. There is hope that can save lives. Thank you guys for coming in and watching. This is the one. This is T. Thanks, T. Get out of my video. So that was my informative briefing. Sorry I got kind of choked. I'm not sorry that I got choked up, but I'm just glad. Thank you. I'm glad you're here to bring me a tissue. Have a good day, everyone.